some of you may already be familiar with this, but others may not. I think, however, it's important that as a basis for understanding the treatment that we're proposing for vitiligo, that you understand the role of narrowband UVB in the repigmentation of vitiligo and how this works in combination with afamelanotide. So in areas of vitiligo, in those white patches, there is a deficiency in melanocyte function. And they are, that area isn't able to obviously produce the same pigment as the surrounding skin. So on the left-hand side here, at the base of the hair follicle are stem cells. And with narrowband UVB, you are irradiating the skin and you're stimulating those stem cells to undergo maturation. And they do this to form fully functional melanocytes in the skin. Now, these melanocytes are intended by these little lines around the diamonds. These are melanocortin receptors. And so you've then matured a stem cell up to being a fully functional melanocyte in the skin, and it's got melanocyte receptors. Then you treat that with afamelanotide, and that stimulates pigmentation or increased pigmentation. So over on the right-hand side here, you can see little brown circles. These are little areas of follicular repigmentation where you've got melanin being produced in the melanocytes surrounding those hair follicles. And with continued treatment, those little brown circles will grow in size, and then they'll start to join and form a sort of a fairly uniform skin pigmentation back again. Can I have the next slide, please? Okay, so this slide shows our pathway to the market. Initially, we started with two studies, CUV 102, CUV 103, 103 obviously following 102. These were early phase studies in which we demonstrated the product worked, and we got an understanding of what sort of endpoints we would choose. So that was the purpose of the earlier studies. We then moved on to two additional studies, CUV 104 and CUV 105. CUV 104 is a study in which patients are treated with afamelanotide alone to see the impact that has on their vitiligo. And CUV 105 is the first of our pivotal studies. It's looking at afamelanotide plus narrowband UVB compared to narrowband UVB alone. And given that narrowband UVB has become the standard of treatment for vitiligo patients, it seems to be an appropriate comparator for a study like this. We have in the planning an additional study, CUV 107, which will be effectively CUV 105 repeated, but maybe with some minor modifications based on the outcomes that we're seeing coming from the CUV 105 study. But just some points to note along this pathway. We have confirmed, and there are over 15,000 implant administrations now, and the safety profile is quite predictable. And so that's important for a regulator to have comfort that they're not going to be introducing a drug that may be harmful. And so, yeah, we've seen a fairly consistent safety profile. And now if you were to start a new study, you would almost be able to draw up a table of the adverse reactions that you might expect to see. So it's become that consistent. We can cover off on market potential in the Q&A session. So if we can move on to the next slide, please. Okay. in order to get registration, it's important that the regulators are familiar with your program and familiar with what you're doing. And so, we have been in constant communication with the regulators over what we're doing and what we're planning to do. So first of all, in this study, we are recruiting 200 patients, and these will be a mixture of adults and adolescents, so that we'll actually gain some additional clinical data on adolescent patients. We're also focusing on the patients who have, I guess, the most problem with vitiligo, those with the darker skin complexion, so skin types 4 to 6. These are the ones where there's the highest unmet need. In terms of endpoints, our primary endpoint is the extent of repigmentation on the total body surface area. And we use the term T-VASI 50, which is total body, T for total body. VASI is the term, is a tool that's used to measure the extent of depigmentation. So we're looking here at the change in the pigmentation in the skin, and 50 means 50%. So we're looking at the number of patients who have had repigmentation or 50% repigmentation of their existing vitiligo. The secondary endpoints we're looking at are evaluating repigmentation on the face. And of course, if you're a darker skinned person, and you've seen the slides already in this presentation, areas of vitiligo on the face are quite severe and can have a profound impact on the patient. So the extent of repigmentation on the face is important, and we are going for F-VASI 75, which is face, VASI, and 75% improvement in the VASI score. Okay, are these endpoints that we choose in isolation? Well, there's been a lot of work done on vitiligo over the years, and so it makes sense that we use endpoints that the regulators are familiar with and those which are commonly used. And on the right-hand side of that, you can see there that other pharmaceutical companies have used those same two measures, F-VASI 75 and T-VASI 50. A secondary endpoint, or our other secondary endpoint in the study, will be how long they maintain that pigmentation. So you've repigmented them. If you stop treatment and the pigment disappears in a week, not very good. So we're actually measuring the period in which that repigmentation has been maintained. So we believe these are appropriate endpoints, and this validates, it's validated by other companies that are working in the area. Whilst I'd like to come to this quote at the end of this presentation, I'll actually talk to it right now, and then in the next few slides you'll see why. This is a quote from one of the vitiligo expert panel members, and it relates to afamelanotide being the only drug in the vitiligo space that actually directly works on pigmentation. So it actually acts directly to increase the pigmentation in patients, unlike the others which work in different ways, immunosuppression and other things, to then allow the body to return to normal. But in this case, we are working directly on pigmentation. So the quote says, once on the market, SCENESSE will clinically become the pigment booster for every dermatologist in North America. And, given its mechanism of action and what I'm about to show you, you can understand why this is a statement that's been made.